Okay, I want you to listen to these symptoms. Fatigue, weight gain, depression. Does that sound like you? If so, you could be suffering from low thyroid, and you don't have to suffer anymore. Here with the truth about low thyroid is chiropractic physician Dr. Joshua Redd of RedRiver Health and Wellness Center joining us today. So good to see you.
Thanks for having me again.
You know,
Love being here with you.
I like it when you're here too, because you really make it easy for us to understand. And I can't tell you how many, all those symptoms I just read off, how many
so
people
common.
I know.
Yeah,
right.
for sure.
Right.
For sure.
So how do you know if those are just symptoms of something else, or if they really are from your
If they're
thyroid?
lasting for a prolonged period of time, you should get it checked out as soon as possible. And it's so easy to check. All you have to do is just simple blood work to see exactly what's going on there. I mean, simple blood markers. We typically will do what's called the TSH marker, but then also check for underlying issues that will cause the thyroid problem. So there's a lot of patients that know they have low thyroid, they're on thyroid hormones, but nobody knows what's causing it. And that's a huge factor to check for, like huge. Yeah.
How do you find out what is causing
So
it?
the most common cause is a disease called Hashimoto's disease, which is an autoimmune condition that attacks the thyroid at a rapid pace and causes a permanent low thyroid. But there's a huge problem here. This causes more systemic inflammation and symptoms, not just primary thyroid symptoms. And so these patients' quality of lives are awful, but they're saying close to 70 to 80% of patients with low thyroid actually suffer from Hashimoto's. So it's a lot bigger, more complicated problem than what most people are used to.
So Hashimoto's means that the inflammation is more widespread through your body?
Yeah, so it's more of an autoimmune condition.
Right.
It's more of an immune system problem, not just a thyroid problem.
Okay.
The thyroid in these cases are just the victim that are really, you know, the immune system is really causing the problems. This causes problems with brain, with intestinal tract, with the liver, with blood sugar levels, with cortisol, with hormones, with so many different things. And so these patients will be on thyroid hormones, but still feel typically, you know, little to no improvement and slowly get worse and worse and worse. And then here's the caveat, it can turn into other autoimmune conditions too. And so these patients might have antibodies attacking joint tissue eventually, or brain tissue, or stomach tissue, who knows what else.
Oh my goodness, that's really scary.
It's a lot bigger, more complicated problem than most people think.
So are you able to determine Hashimoto's through a blood test?
Yes, it's so easy. So we'll check for TPO antibodies, anti-thyroglobulin antibodies. We'll also check for underconversion problems of the thyroid, protein binding problems of the thyroid, pituitary thyroid problems. Most of these patients, they just check what's called the TSH marker.
Right.
And that's typically it. They might check a T3 or maybe a T4. We'll do like a full workup as far as, okay, let's get to the bottom of why these patients have a low thyroid. And if it's something that we can help, let's work to improve it and not just treat symptoms.
Okay.
You know?
How is it that you, besides that, it sounds like you take it to the next level, how is it that you help patients feel better again?
Yeah, so here's the thing. So most of the time they're given medications for symptoms. Our goal is to look to see what's causing these underlying problems. And once we identify that, then we'll use nutrition, diet, and lifestyle to upregulate, enhance, and improve function. But it's a lot bigger than just like, okay, here's a pill or here's supplements, that's it. It's like we have to identify the underlying mechanisms, do the proper blood chemistry, apply the treatment, and then identify and make sure that it's improving and make sure that the blood work shows it, and obviously the patient will feel better and all that stuff as well.
I appreciate you saying that. It's comprehensive. It's everything about your body, what you eat, everything. Yeah. This is a sample of some blood work of one of your patients.
Exactly. Look at this patient on the left-hand side. This is 3 months prior. You can clearly see all the highs and lows. Clearly this patient is struggling. This patient's only 30 years old, keep in mind. 3 months later, after we identified the underlying issues and we started to work on these specific imbalances one by one, she's clearly feeling a lot better, but look at the difference between her blood work on the left and the blood work on the right.
This is 3 months?
3 months is all.
Wow.
But here's the thing, there's so much that we can do with diet, lifestyle, nutrition. There's also a lot of education that has to go along with this, because these patients are causing their condition to get worse and worse and worse and have no clue. But if we can just really identify the underlying issues and then build a specific treatment plan for each patient for their individual needs, that's when the sky's the limit.
That's the key right there for each patient.
Exactly.
We're all different.
So
We're all different.
You betcha.
All right. And Dr. Redd also has a book on thyroid. It's called The Truth About Low Thyroid, and how it is helping his patients. It's something that you can read and learn more about to see. You know, you have to arm yourself with information.
That's it was really #1 on Amazon for quite a while too.
Congratulations to you for that. All right. Dr. Redd is offering you a free consultation. Anyone who comes in for a consultation will also receive a free copy of his book, The Truth About Low Thyroid. RedRiver Health and Wellness Center is located at 8765 East Bell Road. That's Suite 103 in Scottsdale, 480-970-5555, or you can visit his website. It's RedRiverHealthAndWellness.com.